Order of blood draw. Most often than not, patients have more than one blood test ordered, which means that more than one tube of blood is to be drawn from the patient. The phlebotomist needs to be aware of which tubes are needed and the order in which the blood needs to be drawn. The same multi-sample needles can be used to fill multiple tubes for the same patient, but precautions must be taken to ensure that material from an earlier tube is not transferred to a later tube, thus contaminating the sample. The Clinical and Laboratory Standards Institute, which is CLSI, has developed a set of standards for proper order of draw. The order of draw is the same for syringe draws. The order of draw has gone through revisions over the last 10 years, and not all institutions follow the revisions. It is critical to follow the order of draw for the institution where the blood draw is taking place. It is essential to check the department manual for specific blood draws and the correct order of draws. Example of order of draw. Blood culture tubes or bottles, which is a yellow sterile, are first. These tubes are sterile. Phlebotomists should not transfer from a non-sterile tube to a sterile tube. Disinfect the tube's rubber septum with 70% isopropyl alcohol and allow it to dry. Fill aerobic bottle first. Follow manufacturer's directions for special circumstances. Light blue tops, which is coagulation tests, are next. These tubes are always drawn before tubes with other kinds of anticoagulants. The phlebotomist must be aware not to have cross-contamination with other additives that could interfere with coagulation testing. Red/gray, gold, and plastic red top tubes are next. These tubes contain clot activators. It is safe to draw glass red top tubes because these tubes do not contain additive. Green top tubes are next. Heparin in these tubes is less likely to interfere with EDTA containing tubes. Lavender top tubes are next. EDTA binds to calcium and may give a falsely low calcium and falsely high potassium reading. Lavender tubes are drawn near the end of a multi-tube draw. The gray top tubes are last. This tube contains potassium oxalate, which can elevate the potassium levels measured in an electrolyte analysis. Potassium oxalate can also damage cell membranes. Sodium fluoride is another additive to gray top tubes. Sodium levels may become elevated, and that will inhibit many enzymes. Other tubes may be drawn after these 6 tubes have been drawn.